Thank you for staying with us. In Nigeria, the need for safe and regular blood donation is more urgent than ever. Each day, thousands of lives depend on the availability of blood from women in childbirth, complications to accident victims and patients undergoing surgery or cancer treatment. According to the National Blood Service Commission, NBSC, Nigeria needs over 1.7 million units of blood annually to meet the country's medical needs. Despite the high demand, voluntary blood donation remains critically low. One of the many persons advocating for safety blood donation is the founder of the Project Smile Group, the 500 Lives Initiative, and Nigerianism. This is a movement that is recruiting about 1 million voluntary blood donors across Nigeria and is also committed to driving healthcare reform in the country. He's also a dual certified medical doctor, Dr. Ossai Jude. Good morning. Thank you for joining us.
Good morning.
Good morning.
You're welcome. Now, ahead of World Blood Donor Day, which is tomorrow, I believe, a number of concerns from persons, professionals like you, have been raised regarding how there is a waning donation of blood, not just in Nigeria, but seemingly across the world, as the case might be. But talk to us about perhaps the importance, when you look at our peculiarity, what we do not know about why we need to donate blood, and perhaps there are myths surrounding it, and what even is blood donation.
Thank you very much for that question.
Right.
First of all, the major issue in Nigeria is culturally, we are not, what I say, in tune to donate blood. Nigeria is generally a traditional country. And it will amaze you that not many people who are aware that someone else can benefit from the blood in their body. Talk less of even realizing that there's something called blood shortage. So with that being a major problem, our two things we need to solve is, first of all, we need to inform people that people can actually benefit from your blood, and which is what we need them to donate. And secondly, if you don't donate as often as you should, there will be called blood shortage. So now, why would people not even donate? Those who are aware, there are several myths. Some would say, especially let's start with the women. Some women would say that they donate monthly flow. That's even a good reason. I mean, there are ways we can go around that, basically. But some would say women are not supposed to donate blood for some reason. Okay. Some would say that I've not eaten since morning. So is it blood I was supposed to donate? Yeah. Another would say that if I donate blood, I will die. You know. So all of these are all false myths that we need to burst, basically. But then we also need to tell people that if there's a shortage, there is going to be a whole lot of disaster in our healthcare system, which our healthcare system is currently undergoing.
Really?
Yes, it is.
It's good you mentioned it, because I wanted to ask, why are you putting, your organization putting such an elaborate program to get people to donate blood and so on? Are we that deficient when it comes to blood?
So the statistic that was just read was that we need 1.7 million. Actually, WHO says every country needs 1% of its population. So Nigeria is 200 million, so like 2 million, give or take. So let me ask, how many do you think we donate yearly in Nigeria? The question is 500,000. And what is the equivalence in percentage? That is about 25%. The question is, what happens to the remaining 75%? So there are about 75% of emergencies actually in Nigeria needs blood. So how many of those 75% of emergencies actually get blood? It will shock you that of the preventable deaths we have in Nigeria, 20% is because there's no blood. 20 to 30.
Yeah, and let me just, first of all, I want to say this is a fantastic idea, because I know people that they've gone to hospital and they say there's no blood, and it's either they were admitted or they didn't even get blood and they passed on. So I think this is a beautiful initiative. But now my problem is I want to go grassroots. I really want to talk about the myths, Because some people actually want to donate, but they've put it around their mind and they are scared because, like reasons that you said, how well are we going to educate people on that? You can still donate blood and be okay. And these are the important reasons why you have to save a life. Because trust me, we speak a lot about it, but people are still afraid. Like, and I'm going to use myself, for example. I still have some speculation. I'm afraid, like I still have my reservations. How are we able to educate people more that you can do it, you'll be okay, and it's okay to save a life?
I'll say information abhors a vacuum. Or let's put it this way, the mind abhors a vacuum. If there is no information to fill the mind, or good information to fill the mind, bad would. So the question is, how much information is out there? How much advocacy? And this brings me to the government. What is the government doing about creating awareness and advocacies? And this is the difference between the European countries or other countries who have gotten it right compared to Nigeria. Because unlike these countries, the governments are putting information there so that people are able to, educate themselves and then make their choices or make their decision. But we don't have it. So what now happens? Fear is giving permission to seep in. And what's the essence or where is the source of the myth? It's from fear. You'll be shocked. Someone just slept and woke up. And if this is what he feels that if I donate today, I'll die. And he just publishes it on Twitter or something, and that's what becomes the trend, basically. So what is the government doing? What can we do? And even what is the government doing to support NGOs that are actually doing this public awareness, basically?
Interesting. What is the government doing? But we always put the bulk of the blame on the doorstep of government. But government cannot do it alone. And that's why NGOs like yours come in to work perhaps hand in glove with government. If government is not doing enough, have you tried to engage government to say, you see, we are here to help bridge the gaps that we are seeing regarding this matter to addressing emergency situations in this country? And if you did, what did government say? What kind of response did you get from government? Maybe from state government like Lagos State or anywhere around the world.
You just defined what our project is all about. Nigerianism. Nigerianism is a movement to galvanize the whole country and all stakeholders involved to actually look at this problem of blood shortage, from government to even NGOs to blood transfusion services. And in the last 1 year, we've been doing that. In fact, tomorrow, which happens to be World Blood Donation Day, we're having a blood drive across 36 states in the country. That's massive. So the question is, if you've not engaged enough stakeholders, we won't be having that. We've engaged a lot of blood transfusion services in Lagos State, for instance, which is holding at GJT Park tomorrow from 9 to 4 p.m. We'll be having Lagos State Blood Transfusion Service and Lagos University Teaching Hospital, two of our very great partners that have really helped us so far. But to be honest, a whole lot of things is actually based on funding, because even when you want to engage government, we want to encourage government to do some things like fund the blood banks, like create a lot of awareness. I was so shocked that awareness and campaign cost a whole lot.
You're shocked?
It cost a whole lot.
For how long have you been doing this for?
So the Family Lives Initiative has been in existence for the past 7 years. But the Nigerianism movement is just a 1-year program. We just wanted to just give it a very big shot. And hopefully at the end of, which is tomorrow, we'll be able to recruit 10,000 volunteers, which means we'd have been able to convince 10,000 volunteers, 10,000 Nigerians rather, to join the Blood Donation Club, because we are also a Blood Donation Club.
Okay.
You should join.
Maybe, okay, I'll follow suit. Once you register, I'll register.
Don't worry now.
I'm already registered, but let's go.
Okay, that's just on the lighter note. We've been talking about blood donations and all that, and the average Nigerian watching us right now might be wondering, why is it necessary? Quite a number of people have not found themselves in situations where they have to donate blood, and we are now talking about how important it is, and it's like we're talking over their heads. So could you please give us blow by blow reasons why donating blood is really important?
The first reason is saving life. I know that has been flopped, because the average Nigerian will come to this same quote, have I finished saving my own life? But that's the core of humanity.
Yeah.
We have to help one another. I give it to Nigerians, to be very honest, despite the very precarious socioeconomic situation. many people still go out of their way to help one another in several ways. And this is one of those very great ways. You might be so surprised because thank God God has given us His blood freely. Just imagine if there was a price to the blood. How much? How many people would really afford it? And then the other day I was in the hospital and there was a woman who had just given birth and she was bleeding, she was pouring out. And we just needed 2 pints of blood. She was O negative. Of course, we had to run to Twitter because that's now the trend. When you need blood, you run to Twitter, you run to your WhatsApp status, you run on Instagram, which is very cumbersome. It's not the way it's supposed to be, basically. And that's where we come in, where we have registered or recruited blood donors who at any demand, when we put up in our communities, one person will probably be willing to donate. So we are going to 1 million in the next 5 years. But come to it, we are helping. Eventually, we got the blood, and if we hadn't gotten the blood at that time, this woman would have passed away. The person who donated the blood, I'm sure is probably sleeping in his house and doesn't really understand that another woman is walking on the street because he donated. So it's a whole lot of joy to get. Then there's also benefit of free health check. It's the cheapest way, let's put it that way, to have a free health check for donate blood. They will check your BP. You will know if you are hypertensive or not. Do you know the number of people who have been checked or flagged for hypertension and asked to go to their doctors for follow-up? And
but not to cut you short, this takes me to my next question. Let's say I'm listening to you on TV this morning, our audience are listening, and they're like, okay, what he's saying, I want to donate blood. Or let me put it this way, what are the criteria you need, or how can you be fit to say that you can donate blood? Let's say I, Ria Abdul, right now, I want to come tomorrow to donate blood. What are some of the things, how am I eligible? What makes me eligible to donate blood?
First, I'm actually expecting you tomorrow.
I will be there. I will come.
Because number one, you're above 18.
Yeah, definitely.
We want to be sure that you're not a child and you can make that choice of your own accord. Then secondly, we want to be sure that you're not underweight as well. We want to be sure you're not underweight.
What is underweight and what is
underweight?
overweight?
Is when you're less than 50 kg. Basically.
Stop my diet.
So that's the next thing we want to check. Then other things we want to check is, in the past few days, have you been treating any illness, basically? Because donation has to be safe. The person receiving your blood too, and you shouldn't have a worse illness afterwards or something. So if you are ill, it's fine. It could be just a malaria. It could be just take your time, take your drugs. Attend to your health, and when you are fit, we're very glad to have you, basically.
I think another matter is safety of blood donation.
Yes.
There are those who have gone to do that and did not remain the same afterwards because of one issue or the other. So the safety is on the one hand. The other thing is that some persons think that once I mix malt and milk, I'm fine. I don't need blood donation. There's even one leaf they call either Yanopaja or something that people believe that that's the way they can get blood. So all this one that you're talking about is flying over their heads. But help us address that one as well.
So there are different levels in where you would require a transfusion. Yes, there are some levels you have. It's called mild anemia. You just need to probably look at your diet. You want to, your diet, basically take things that are rich in iron, basically. The doctor may put you on some hematinics as well, fesolate, folic acid drugs, basically. And then there's another level, right? Now, we start thinking of transfusion, depending on whether you are probably severely anemic, or maybe you could even just be moderately anemic, but then you have an underlying condition and you need a transfusion. Basically, in that case, you need blood. You actually need blood, and it's not diet that would actually.
Also, malt and milk is not
doesn't work. I was just going to say something.
It doesn't work. No, we need to clear that.
To the best of my knowledge,
it doesn't.
It doesn't work.
But safety. How about safety?
Safety. When you come to donate, we are screened. If you go to any center, I'm saying international, if you go to any center and you're not screened, they just say, come and donate blood, please just walk away. No, your safety first. You're screened. What I mean screened is you're checked for fitness. Do you have enough blood to sustain yourself and then a little more to give? That is what we look at. Once that criteria is met, and then the other criteria, maybe we check your blood pressure, we check your weight, and it's all good, please go ahead and donate. And then when you donate, we still check the blood. Is it free of any illnesses like hepatitis or some other illnesses? If it's not free, you can best be assured we will contact you to tell you, please go to the doctor for follow-up. Basically, it's one of the advantages like I mentioned.
And before I go to my question, I'll quickly say something. The way Nigerians, the way we are, sometimes you don't want to go because you don't want to hear. They say, what I don't hear will not kill me. So that's another reason why they don't want to go, because I want to go and donate blood now. I've heard that I'm very sick. I was in my house, so I did not go to hospital. So I feel like that's another thing that, we need to highlight on. But with what Veronica was saying, I tell people, because I have a lot of friends that are doctors. So when you talk about medicine, I know a bit about it. Like, there's a situation that you get to that you cannot even drink more than milk. At that one, maybe you're in coma or something like that. It doesn't even, you can't even get leaves. What are you thinking of? So then that's why I'm like, this initiative is so, like, I feel like it's something that would really help a lot of people, because we see people die daily because of this. But beyond Saturday, what is going to happen?
Beyond Saturday, welcome to our world where we are going to be encouraging and helping all our registered and recruited donors to commit to their quarterly commitment of donating blood. So it's a blood club.
Quarterly?
Yeah, so if you donate blood today, you can check back in like 3 months, thereabouts. You should be fit to donate blood.
Drink another one?
Yes, another one.
Every 3 months?
Yes. But then there are other criteria. If you're a lady, of course, you want to check, are you on your period, basically? Because, you want to be checked, you have enough for yourself, remember. So you want to check every 3 months.
But sorry, talking about ladies and men, as a doctor here, let's clear it here. Do you think it's more advisable for men to donate blood than women? And be honest.
Ladies and men.
Are they all on the same?
They are all on the same.
Or one is higher than one?
They're all on the same.
Okay.
I don't know why.
No, because we all hear that.
Blood has no gender. Let's just put it that way.
Thank you, I like that.
Blood has no gender. All right. This initiative you are pushing, it sounds good. And when it succeeds, not if, when it succeeds, it's going to save a lot of lives. But we have seen initiatives like this before. They come here, we talk to them about the initiatives and all that, and after that, we hear nothing about it. Is this going to be a one-off, or it's something you'll do regularly?
First thing first, I would not forgive myself if this is a one-off. I know what the last 12 months has been for myself and my team. Basically, in fact, my team would forgive me. But let me speak for those organizations who have one-off or who have had a one-time wonder kind of streak. It's not easy to run an NGO in Nigeria. The funding,
That's a major challenge.
the funding, basically, I'm very privileged to have very committed core members. Shout out to my core members. They're absolutely the best, basically. But then I'm looking forward to, as much as it's an NGO, there would have to be paid staffs, basically, because we can't be running on vibes and, vibes and inshallah. And if there was anything that was going to probably stop us is, the funding, like many organizations. But what we are trying to do is we're trying to build a structure to where we are able to apply for grants, and as many meaningful Nigerians too, who also see what we are doing and appreciate it, can also support us and all of that. And hopefully the government too. I'm sure the government is watching.
I see funding is like your major challenge.
The funding is a major challenge for many organizations.
Yeah.
I would say.
So talking about awareness, I want to take it back now. It's your team looking at taking that conversation to schools, government organizations, and all of that. How are we going to create that mindset in the mind of younger generations so that when they get to that age of 18, they can now see the need to be a part of a cause like this? So what is the role of government, state government or federal government, schools, organizations in being a part of driving this initiative?
Everybody is needed to drive this initiative, and my team, we acknowledge that basically. For now, we are just all about creating a national awareness. And post project meaning Nigeria is just a one-year project. From next tomorrow, what we now want to start doing is trying to trickle it down. How can we now go to, like you said, secondary schools and bring more government parastatals and what have you not. But more importantly, we are doing nationwide blood drive because we want to tell people, expect more thought-provoking and audacious project. In fact, you won't be surprised if we go for a Guinness World Record for the highest number of registrations in a single day in the coming month.
But what does registration achieve if people are not willing to donate?
Registration and recruitment. So let's break it down. Why do we have blood shortage in Nigeria? One of the things is, yes, a few times we don't have enough donors, but even the donors we don't have a sustainable and comprehensive database for them. And this is one thing that many countries who have gotten it right have. If you have donors, you're supposed to have them in a system where you're able to send them personalized messages like birthday messages. If blood is collected from me or from you and it gets to someone, actually you're supposed to know. Like, oh, really? So person just received your blood. The idea of encouraging commitment comes with, being able to, what's the word now? Help people feel happy about what they do.
Feel gratified that you've done something good.
Tomorrow is World Blood Donation Day, and actually the government is supposed to sponsor nationwide celebration of these donors, so that you look at it, you feel like you're in a family, and it's like a badge you carry, basically. So this is some of the habits and cultures we want to bring in, basically. And so we're going to be very audacious about it. Registration goes a long way. Registration, and then continue to reach out to our community and keep the community vibrant.
Do you incentivize them at the end of the day?
Well, incentivization always is picky when I talk about that, because no one should go and donate blood and be expecting money in return.
Of course
it's
not.
not right, basically.
Because you're not selling the blood. Yes,
and it's going to encourage unsafe blood donation.
But hospitals sell them.
These are some of the things we are fighting.
It's not supposed to.
Hospitals sell them. So I should be careful about that. Some hospitals probably would sell them. And I believe this is some of the reasons why some Nigerians are angry, like hospitals sell blood, this and that.
Absolutely.
Yeah, so if I'm giving my blood for free and the hospital is selling it.
But generally,
it's 100% profit for them. Generally,
hospitals are not supposed to sell blood.
Okay.
If you actually pay money to a hospital, this is how I want to say it, in a standardized hospital, you're actually paying for screening. Blood is not going to be collected from me and given to you straight away. It is not right. What if I have one terminal illness? So, it makes sense that I will ask from you just a token to screen that blood.
Those monies don't look like tokens to me.
So now, there are several hospitals in Nigeria, let's put it that way, and I can't speak for all hospitals, but I can speak for the standard way. Because even Nigerians feel like they shouldn't pay anything. Actually, the government, this is another place where we need the government. The government is supposed to either subsidize or actually take that burden. In some countries, in the UK, for instance, there's massive subsidization for the screening of blood, basically. It costs a lot to screen anyways. There's going to be massive investment by the government. But if the government is not doing that, or if the subsidy is not good enough, you have to pay. It's for your own safety. Absolutely. And it is just screening fee, basically.
Not the blood itself.
It's good to know that hospitals are not supposed to collect money for blood, because I tell you what, hospitals, you pay for oxygen, you pay for blood, you pay for almost everything.
But I would also say that, because there's also a flip side to it, you need urgent blood right now, right? And then there are these touts going around the hospital, because it's somewhat a business that we are fighting with all our might. That no, please, Nigerians, if you come in mass and you donate, this would not exist. So there's this touts who are running, floating around, basically. And because you don't have someone who wants to freely donate for you, you are left with no choice but to approach these touts, basically, to say please, and then you give them money, basically.
Okay, because of our time, quickly talk about tomorrow's event and how people can attend quickly.
Tomorrow's event is happening first of all, it's happening across the country, Akwa Ibom, Ebonyi, at different states. You can get the locations for those states on our Instagram page, 500 Lives Initiative, or on our website, the 500livesinitiative.com. But for Lagos State, we're having our event at JJT Park in Alausa, Lagos. It starts from 9 a.m. and it ends by 4 p.m. There are buses available for people at the following locations: Lasucom, Lut, Unilag. Those 3 locations, and Yabatek. There's a whole lot of fun and games, because we try to make it very interesting.
Who are those that can't come? At what age? The age bracket?
From 18 to 65, basically.
18 to 65. You should be there.
Veronica, you should be there. But well done.
Dr. Ossai Jude, dual certified medical doctor. Thank you so much for your time, and we wish you all the very best. Ria will be there tomorrow.
And you'll see me there tomorrow. I think we should all go rally around and support. It's a fantastic initiative.
That's where we have to wrap up the conversations.
Thank you so
It's a
much.
pleasure to be here.